Percutaneous low-energy osteotomy in treatment of pathological coronal deformities in pediatrics. It is a newly published paper by Prof. Khalid Imara et al. In the Journal of Pediatric Orthopedics B. The aim of this study was to assess the safety and efficacy of percutaneous low-energy osteotomy and casting in treatment of pathological coronal deformities in children equal or younger than 6 years. Concept of this method is to try to avoid guided growth drawbacks, which include the slow correction, the non-compliance, the need of close follow-up, and the need of second surgery. In addition, it tried to avoid the drawbacks of osteotomy that usually accompany internal fixation or use of K-wires, such as infection and loosening. It was a prospective non-randomized case series study, and it was conducted on 62 patients. The population study was 62, 40 boys and 22 girls. They were 3 to 6 years old, with mean age at 4.5 years. They were followed up after surgery for 3 to 10 years. The pathological nature was variable: rickets, Blount disease, dysplasia, post-traumatic, and post-infectious. There were 38 patients with various deformity that were treated by tibial osteotomy, and there were 24 patients with valgus deformity that were treated by femoral osteotomy. Surgical technique. With the patient supine on a reducing table, the metaphysis is identified using an image intensifier. A small skin incision is utilized, not longer than 0.5 cm. The osteotomy is performed at the concave side of the bone, and the far cortex is kept intact but weakened by multiple drilling, at which the osteoclasts will be followed. High above knee cast will be followed the surgery, controlling both the sagittal and coronal deformities. The parameters were clinical in the form of clinical correction and radiological in the form of tibiofemoral angle and mechanical axis deviation that were evaluated annually and at the end of the follow-up period. There were a statistically significant improvement of all parameters, including mechanical axis deviation as well as tibiofemoral angle in both groups. Clinically, all the cases were completely corrected. An example is 4-year-old girl has bilateral genovarum that was treated by percutaneous low-energy osteotomy and casting. Here is the post X-ray after removal of the cast after about 6 weeks. And this is the clinical appearance for the girl before the surgery and after removal of. Complications. 4 limbs of the virus group had overcorrection. 3 limbs, 2 with virus deformity and 1 with valgus deformity, experienced recurrence that required revision. No other complications were experienced that include non-union, malunion, neurovascular complications, compartment syndrome, or infection. The total complication rate was low as 6.4%. Conclusion. Percutaneous low-energy osteotomy and casting is a simple, safe, and effective method in dealing with 6 years and younger children with pathological coronal knee deformities. There is a need of a comparative studies with other surgical techniques as well as tailoring the indications of this operation.